Hi, my name is Cheska. I'm a student physical therapist at Rocky Mountain University. I'm here with my patient Jack, who is complaining of left neck, parascapular, and arm pain, which radiates distal to his elbow and radiates down into his hand. He doesn't know exactly what happened that created the pain in his neck and in his left side, but he knows that after he was done landscaping and lifting heavy rocks, he started to feel gradual pain in his left extremity, in his left side of his neck, and then just radiating down to his hand. He denies any trauma to his cervical spine, but notices that his left upper extremity has gotten weak, and he has a pain of 8 out of 10. After some tested measures, he is likely to have a disc herniation at C5 and C6, resulting in a cervical radiculopathy, in which that's an indication of mechanical cervical traction. Some other indications of traction include muscle spasms, joint hypermobility, nucleus pulposus herniation, degenerative disc disease, spondylolisthesis, and then facet joint issues. Some contraindications include acute muscle sprain or strains, vertebral fractures, non-mechanical pain, osteoporosis, osteopenia, and cardiovascular and pulmonary complications.
Hi Jack, my name is Cheska. I'm a student physical therapist. I'm going to be working with you today. How are you doing?
Oh, I'm doing okay. My neck just been killing me, especially on the left side, and it hurts in the back.
Okay. So we're going to try something called traction. Have you done traction before?
No, I've heard of it, but no.
Okay, so what this thing is going to do is kind of just pull your head back here, and that's just going to kind of relieve the pressure and hopefully the pain where your spine is back here. So since it is hurting you in the back, we're going to go through a posterior protocol, which means that your neck is going to be kind of in this position to start with this machine. I just want to ask you a couple questions before we actually do the treatment, just to make sure that it's okay to proceed to do it. Do you have any like fractures in your vertebrae at all?
No.
Okay. Any like muscle spasm, muscle strain, or anything like that? Any
No.
strains? No. Do you have any osteoporosis, osteopenia that you know about?
No.
Okay. So if it's okay with you, we're gonna go ahead and continue with the traction. Is that okay?
Yeah, that's
okay. So what I want you to do is I'm gonna go ahead and have you just lay down here. We kind of want your neck to be right where these like cushions are. I'm gonna tighten these cushions so they're gonna come closer, and it's gonna be kind of snug behind here. So if you want to go ahead and lay down for me, I'll kind of direct you so you don't bonk your head. Okay. Does that feel okay right there?
Yeah, that's good.
Okay, so I'm gonna start making these things a little closer, and then just let me know when it starts to feel snug.
It's pretty snug right there.
Okay. And then I'm also gonna put the straps around your forehead just to make sure that you don't move your head around. That would change like the pressure that we're putting on to your head. So I'm gonna go ahead and just add this strap. Put a tissue here for some sanitization. Alright, are you doing okay?
Yeah,
Alright.
that's good.
Okay. So next thing is usually like a head weighs about 12 pounds, and we want to do about like 10 to 15 pounds usually to start, but since this is your first time doing this, we're going to kind of keep it light just so that you know how it feels.
Okay.
So I want you to just relax there, and then I'm going to start pumping up the pounds, and then let me know when it starts to feel like too much, or if it's just a stretch. That's good too. Okay.
Okay.
Okay. Put it on here. Feeling okay?
That feels pretty good right there.
Right there. Okay. So I'm gonna hold it here. And then I'm gonna give you this bell Just in case you start to feel too uncomfortable or anything, you can hit this bone, and then we can try to release you from the machine. So I'll give you that.
Thank you.
And then also with this pump here, we have it on hold so that it's holding that pressure right now. And then we have the pump and then the release. So if you want to take the pressure off, just turn the
Dial.
the dial. Thank you. Turn the dial to release, and then you're good to go. Okay.
Okay, sounds good.
I'll put this right next to you, and then I'll put a timer for 5 minutes, and then I'll come back and check on you. Okay.
Thank you.
All right. It's been about 5 minutes. How are you feeling?
Pretty good. It's
Okay.
a nice stretch.
Do you want to do 5 more minutes?
Yeah.
Okay. All right. It's been 10 minutes total. You doing okay? Okay.
Oh, yeah, that was good.
Good. So I'm gonna go ahead and release the pressure there. And then I'm gonna take this strap off, but I want you to just kind of relax here for a little bit, just because we created some separation in your spine. We don't want to do any other damage. So I want you to just lay here, relax, and then we'll get you up and do other things, okay?
Okay, thank you.
Yep.